everyone. I'm Stuart Bambino with the Santa Ramon Chamber of Commerce, and I want to welcome you to a very important seminar today presented to you by Stanford Healthcare Valley Care. The topic today is understanding and managing stress in the midst of a pandemic. This is a very timely topic, a very relevant topic for today especially. Today marks the 1-year anniversary of the start of the pandemic, and we've all gone through a lot of stress throughout the course of the entire year. So welcome again. I want to introduce our moderator for today, Terry Caney. I think many of you know Terry from being involved in the community, but just give you a little background about Terry and his bio. The first time I met Terry was about 10 years ago. And he was the Director of Communications for the Santa Ramon Valley Unified School District. Terry spent 20 years at that position. And then after leaving that position, he became the Chief Communications Officer for the Contra Costa County of Education. And Terry held that position for several years and then just returned recently to the Santa Ramon Valley Unified School District. A couple things about Terry. He was awarded the Employee of the Year by the Santa Ramon Chamber of Commerce and Employee of the Year by the Danville Area Chamber of Commerce. And Terry is a Paul Harris Fellow, if you're a Rotarian, you're familiar with that. And Terry is also the incoming president of the Santa Ramon Rotary Club. In July, he will start his first term. So in addition to that, Terry is a Bay Area native and a former sports broadcaster for KSFO San Francisco. Terry is married to Christine and has 2 children, Trevor and Rachel, and he lives here in San Ramon. One thing that Terry forgot about his bio, which I think is a very important aspect or a little fun fact, Terry sang the national anthem at the Chamber Day with the A's a few years back in front of about 35,000 people. So Terry, thank you so much for moderating this event today, and we're looking forward to hearing more about managing stress in the midst of a pandemic. So thank you so much, and everyone have a wonderful day.
Yeah, thank you, Stu. That was, well, they needed to bring in the B team. I think, yeah. The person who was scheduled to sing that day got laryngitis or something. So yeah, after a couple of pints, we stood in. But good morning, everyone. Stuart, wow, you have some amazing ties with Stanford Healthcare. As you can tell, I'm wearing my cardinal red today. Awesome. Stu, I'm surprised you don't have an office at Stanford Healthcare with as many ties as you've got going there. So maybe that's in the works, who knows. Good morning, everyone. What a timely topic today, obviously, by my math, and we all probably have, a marker by which we can say that this pandemic began, right? And it's most likely based on kind of a pivotal moment in our own lives. For me, it was March 13th, which means that in 2 days, it will be exactly 1 year for me since this crazy period began. I was driving down to a schools conference in the LA area. It was a stormy day. It took me nearly 9 hours to get there. 8 of those hours were spent on the phone, on Zoom calls, conference calls, basically individual rant sessions, because we knew we were on the cusp of shutting down all public schools in Contra Costa County, and for what we believed would only be for maybe 2 weeks max. Well, here we are 1 year later, right? So I finally get to the conference, and it's filled with school communications people, but about half as full as predicted, because many of them opted to stay home and deal with the crisis and the issues that were before us. We ended up essentially scrapping all of the conference sessions because the pandemic needed to take center stage for obvious reasons. And we came to realize that we all needed to rely on each other, right? To try and navigate what our next steps and what our paths forward would be to help our own communities with what we saw coming. So we turned essentially the main ballroom into like a war room. We divided up by region based on where our counties and our districts were in California. And we all went to work in the same room. And we worked into the wee hours of the morning, most of us without showering. And since we had to forego our evening socials at the hotel bar, which, I mean, let's be honest, that's why we all go to conferences, right? Right. We had to get creative, and everyone basically emptied out their own mini bars in the rooms, and we organized things similar to how we organized ourselves. We had vodkas and gins on this table, bourbons and whiskeys on this table, beers and wine over here. Anyway, you get it, right? And we made do, and we got through. My point is that this was arguably the most stressful time of my professional career. And if I didn't have my friends and my colleagues there to collaborate with and to bounce ideas off of, the feelings of anxiety and isolation, I think, would have been much, much worse. You know, I had other plans to open this session, but I scrapped those because I saw something in this morning's paper in the Times that just felt better to me than a few two-bit jokes or memes. So if you'll all indulge me, I'd like to read an opinion piece that was in this morning's editorial page. It's from a local family physician and mother of three, including 2 elementary school age children in Oakland Public Schools. So if you don't mind, I'm gonna read this as we introduce our topic today and our presenters. She writes, on this week a year ago, students in the Bay Area's 2 largest school districts, Oakland and San Francisco, left their classrooms for the last time and have not returned. Their educational experience changed entirely, as did the job descriptions for educators and parents. There was no emotional closure. There was no preparation for the transition. Yet in that moment, it was the right choice. To the best of our knowledge then, it was the safest choice. There were so many unknowns about COVID-19. And 1 year later, we have access to more knowledge and more data. We now know that schools are not super spreader sites, and a safe return to in-person learning is possible without appropriate mitigation, appropriate mitigation measures in place. Yet students remain at home, including my own 2 elementary school age children, as well as the children that I have been caring for as a family physician at a federally qualified health center in East Oakland for more than a decade. Why is that? From my perspective, the debate around school reopening has become political and adversarial. Parents versus the district, versus the union, versus the city. And it feels like it's more about being on the winning team than focusing on the shared goal of safely returning to the classroom. At my children's school in Oakland, they learn a social emotional curriculum called Toolbox. Through these strategies, the children are taught to navigate conflict and have courageous conversations. We adults are forgetting to use our toolbox. Instead of role modeling courageous, compassionate interactions that prioritize our shared goal of safely reopening schools as soon as possible, we post pointed and inflammatory remarks on social media. We send email messages intended to make the other side look as if they are the ones who are rigid and unreasonable. We file lawsuits to force the other side's hand, and we attack each other in meetings that should be an opportunity for dialogue and real listening. This type of behavior would not be tolerated in a classroom. We're expecting more of our children than ourselves. Our children are suffering the most from the dysfunction and the bad behavior of their grown-ups, as my son's teacher calls us. Children's hospitals have seen an increase in emergency room visits for acute mental health concerns due to increased isolation. Students previously highly engaged in academic pursuits are now skipping school because it's boring and not as fun, as my own 9-year-old daughter told me last week. And many of my patients are actually more exposed to COVID-19 in the current learning setup as their essential worker parents piecemeal together childcare. On average, these children have 10 adults involved to keep them safely supervised while their parents work outside the home. To be sure, there are valid concerns about safety and complex logistical issues that must be addressed to make school reopening possible. Acknowledging the fear and anxiety that this brings up for all of us, children, parents, and educators, is critical. Instead of diminishing others' experiences or feelings, We should be holding space for them and looking to find common ground. Although we've been forced to be apart for the last year, we must remember our common humanity. We are all experiencing this together. Most important, we must remember kindness. To move forward, we all need to use our toolbox tools: breathing, listening, empathy, patience, and courage. As author Glennon Doyle says, we can do hard things, and I believe we can do better. That is from Dr. Rebecca McEntee, a mother of 3 and a family physician in Oakland, and I think is an appropriate lead into our topic today. So let's go ahead and get started. It's the reason we're here today, is to enhance our own toolboxes with some strategies to help us all as the fog of this pandemic begins to lift. So let's get started. We only have an hour, and we'll try, of course, now it's about 50 minutes after my rant, but we'll try our best to squeeze in a few questions during a Q&A time. So if you feel the need, please go ahead and place your questions in the chat, and we will get to those at toward the end of today's presentation. So we have 3 presenters today, and we are extremely grateful to Stanford Healthcare for today's timely topic. Our first presenter is Mino Sastry, Vice President of Service Lines and Market Development at Stanford Healthcare Valley Care. Currently, Mino has responsibility for leading the development and execution of business development efforts, including growing clinical services within the region. He is recognized as a leader in professional development, operational systems, employee and customer engagement, cost and vendor management. Prior to joining Stanford Healthcare Valley Care in 2018, Mino served at Stanford Healthcare for 7 years with successive growth opportunities, including his most recent role as the Administrative Director of Business Operations, Security Services, Engineering and Maintenance, and Parking and Transport. Man, do it all, Mino. He resides in San Ramon, awesome, with his wife, Allie, and 3 children. And during his free time, Mino volunteers as a youth coach in basketball, soccer, and Little League Baseball. Mino, I'm going to turn it over to you. Thank you for being here. Go ahead and take it away.
Thank you, Terry. Appreciate it. And thank you for that story. I'm going to steal Terry's line and say I want to thank the Chamber for allowing the B team just a few minutes to speak, because I certainly want to pass it on to the A team. So I'm going to share my screen. I did want to just give a brief update of where we are in our organization with the COVID pandemic. Also, how we responded to the pandemic over the course of the last year, and the safety protocols we have in place today. And then a quick update on our vaccine process. So as I mentioned, I will quickly go through this and answer any questions at the end of the presentation. So as many organizations, hospital organizations in California, we recently got out of what we called our third wave of the pandemic at the end of Thanksgiving into December and early January. But since then, our hospital has seen positivity rates decrease all across our hospital. We've seen our inpatient cases decrease of COVID. And most importantly, we've seen our ICU cases decreasing, all extremely positive news. And I think we're seeing that trend in all of our local hospitals in the region. So very, very excited to report that. Within Stanford Healthcare Valley Care, we also had a number of safety protocols that I'll talk about in just a minute that we implemented at the start of the pandemic and that are currently in place today to ensure all of our staff and all of our community residents and patients that our hospitals is very safe to come and continue to get your care. The one beautiful thing and thing we're grateful about is we didn't have to cut any of our services. We were able to provide all the breadth of our clinical services during the course of this pandemic, which we are extremely grateful for and happy that we were able to serve the community in its full realm. In addition, we had to reinvent ourselves. Just like any other organizations, we had to add more telehealth options for some of our areas, like the urgent care and physical therapy. It just allowed us to get to our patients a little bit easier, more effective, and without them having to actually come on campus if they chose not to. And so these were all things we were able to do. And then lastly, we'll talk a little bit about our vaccination process. So as Terry mentioned, we are approaching 1 year since the pandemic. And, at that time, we were all, as a nation, as a global, the world, and obviously here in California, we were going through some uncertainty. What was the pandemic? What was the disease? How do we treat it? What do we do within our hospital? In addition to that, we were hit with the shelter in place by Governor Newsom in the state of California. So we really didn't know what that was going to be about. So the first thing we did is we activated our hospital incident command structure, what we refer to as HICS. Many of you probably know about the FEMA standard command center structure. Well, HICS is really that same standard structure, but customized for a hospital environment. And it's activated anytime you have any type of event, a disaster, anything that might disrupt your normal operations. And the pandemic and the shelter in place were two events that really disrupted our entire operation because of the uncertainty. So we activated our hospital command center at the very start of the pandemic. We identified very key roles. We assigned people to those roles. Each individual had very key set of responsibilities to manage and to resolve all of the incoming information that was coming from the CDC, from our states, also managing our hospital bed availability. How are we navigating our COVID patients throughout our patient experience? So all of those things were new, and we had to tackle that. And so this command structure that we put into place really allowed us to balance and manage all of that information. In addition, we had to look at our surge plan. All hospitals are required to have some level of a surge plan to deal with mass casualty events. We did have a surge plan, but we had to relook at it. This was a new pandemic. This was new requirements and protocols we had to make sure we can handle. So we revised our surge plan, and we, Stanford Healthcare Valley Care, actually put together a 5-phase surge plan, with phase 0 being our current state. So this is what our current environment can handle. And then at each phase, we created a series of checklists and processes to increase our bed availability. In the event we've got an influx of COVID patients, or any patients for that matter, how are we going to respond to be able to create capacity to allow those patients to come and get an appropriate level of care in our hospital? So each phase, we created a series of items to increase our capacity. What the pandemic made us do is also rethink the way we treated COVID patients. So there's strict requirements. You needed a negative pressure room, which restricts the airflow to treat those COVID patients, so you're not contaminating the rest of the hospital and other environments and other patients. So at the start of the pandemic, we only had 6 negative pressure rooms to deal with these types of patients. Within a 2-month period, literally less than 2 months, we were able to get that to 51 negative pressure rooms. And then when we encountered our third surge over the holiday season in December, we increased it by another 20, and we now have a total of 78 negative pressure rooms. Those negative pressure rooms are still in place today. We can treat both non-COVID as well as COVID patients in those rooms. So we ensure we're providing the highest level of safety for any patient that comes through our walls today. So really excited about the flexibility we've created within our organization. We also had to reconfigure and reinvent our entire emergency department operation. You can imagine, with a small waiting room, we had social distancing protocols, we had visiting protocols, we had isolation protocols we had to implement. We had to separate COVID positive patients from patients that may be suspected of COVID, from patients that are coming in for your normal emergency room events. All of this was done by implementing surge tents outside in our parking lot. This allowed us to separate all of these different patient populations. This also allowed us to decompress the actual emergency rooms within the hospital for our sickest and most vulnerable patient populations. This also is in place today and will continue to be in place for the foreseeable future until we're completely out of the pandemic. So once again, assuring our staff and assuring our patients and community residents that our hospital is safe to continue your care. Lastly, just to talk a little bit about the vaccine, these are some stats from the state of California. This is a little bit outdated. It's about a week old, so obviously these numbers have changed over the course of the week, and we're making great strides here in the state of California. Total administered as of a week ago, over 9 million doses, delivered over 12 million. There was a little bit of discrepancy because early on, I think there was a little lack of clarity around the supply chain logistics. So people are probably holding on a little bit to their doses to make sure we got second doses available. But if you were to look at those numbers today, I think you'll see an even match of doses delivered and doses administered, because we have a great supply chain process really in the state of California. And then you can see the doses administered by every county within California. And we continue to see great progress and hopefully accelerate that. For Stanford Healthcare Valley Care, just wanted to give you, obviously we currently have Pfizer and Moderna as our vaccination supply. As of December 18th, we started to do our own healthcare workers. On January 19th and January 20th, we started to expand to all healthcare workers in the community, non-Stanford affiliated, as well as all patients and community residents over 65 years old. And then as of February 27th, we've opened it up to educational workers, childcare, and all first responders and food agricultural workers as well. Stanford Healthcare Valley Care alone, as of March 4th, has administered over 133,000 vaccines across all of our sites, and 7,000 vaccines alone at the Alameda County Fairgrounds. So really great success, and we feel really proud and grateful for the work that's been put into this. And then lastly, just wanted to highlight our locations that Stanford's a part of and that are managing across Alameda County, but also for everybody on this call. We have some phone numbers there for you to call if you have any questions, and you can see the hours of operations at each of our 3 sites within our hospital, at the fairgrounds, and also for those who might be closer to the Embryville area. So really happy to share that information, and now I'll pass it back to Terry to announce our featured speakers. Thank you, everybody.
Thank you, Mino. Appreciate that. Would you mind doing us a favor and put this information, including the URL and the phone number, in the chat?
Will do. Will
That
do.
would be wonderful. And just a clarifying question, that is open to not just Stanford Valley Care members, but to all people who fit within those categories, correct?
Absolutely. Absolutely.
Got it. Okay. Great. Well, thank you, Mino. Appreciate that. Just a reminder to go ahead, if you have questions, put them in the chat, and we will try to get to those toward the end of the presentation. So, Mino, thank you very much. Okay, our next presenters, and they will be co-presenting. I want to introduce to you Joe Carlucci and Winter Brown. Joe graduated from Downstate Medical Center in Brooklyn, New York in 1982. He moved to California after graduation and has lived in the Bay ever since. He has a Bachelor of Science degree in Physical Therapy from Downstate Medical Center in Brooklyn, a Master's in Health Science from San Francisco State University, a Master's of Business Administration from Sacramento State, and is a Fellow of the Advisory Board of Washington, D.C. Joe has been at Valley Care since 1991, working in various capacities within the physical therapy department, and has been the director of physical and sports medicine since 1997. Joe has also held various administrative positions at Valley Care, including patient safety officer for 4 years, and besides director of PSM, he is currently a patient safety specialist and a team steps master trainer. I'm sure you'll let us know what exactly that means. Does it mean you have to get your steps in every day? I'm not sure. We'll find out. And then Winter Brown joins us. She is a certified yoga therapist and has been teaching since 2009. Winter holds a doctorate in political science from Duke University. She serves as a lead trainer in Dragonfly Yoga and Wellness 300-hour teacher training, and founded its prenatal yoga teacher training. Winter strives to create caring and playful spaces that offer precise cueing, minimal hands-on adjustments, and choices and modifications so that yoga is both safe and inclusive. She combines movement, breath, and mindfulness in order to empower the healer within all of us. So I want to welcome both Joe and Winter, and I will let the two of you kind of navigate from here.
Thank you, Terry. Thank you very much, San Ramon Chamber of Commerce, for inviting us in today. It's always exciting to talk about. It's a funny topic to feel excited about, but it is. I do enjoy talking about stress, if only because I'm a strong believer in that knowledge is power. So I'm going to see if I can share my screen and pull up my presentation. So give me just 1 minute. Hmm. Hold on a moment. I don't know why it's not allowing me. Give me just a minute. Ah, here we go. Okay. Can we see it? Good. Okay. All right. So Joe and I are talking about understanding and managing stress in a pandemic. So before we get into that, I'd actually like to take a moment and borrow from the social emotional learning toolbox that Terry mentioned in his op-ed and invite you to take a moment to breathe. And so it won't be a long time, just a little bit of opportunity to kind of check in and see how it feels to breathe at this particular moment. So I invite you to find a really comfortable position for yourself. And you might close your eyes. Some people find it helpful to kind of close off the sensory vision and tune in a little bit more to what's happening within the body. Other people prefer to have their eyes open. But if you like, take a few moments to start to take your attention and see if you can start to watch your breath as it comes in and watch your breath as it goes out. And just keep watching the breath as it comes in and watching your breath as it comes out. And as you're watching your breath, you might also notice where you feel your breath. Maybe you feel it brushing past your nose or your mouth. Maybe you feel it in your chest or your stomach or your ribs. Just noticing what your breath is like right now. If you can take 2 more breaths, really watching the rhythm and the movement and the feeling of your breath. And when you feel ready, start to bring yourself back. You might open your eyes if they're closed. You might lift your gaze. They've been kind of focused. And as you come back, I want to invite you to just take a moment to notice if anything feels like it changed. And maybe it did, and maybe it didn't. And there's really no expectation or judgment around that. It's just an opportunity to kind of see what that experience was like and if it had an effect, right? So when we think about stress, probably almost every one of us understands what stress is like. And each of us might have our own sense of what really causes stress in our life. Stress is really our brain's response to a demand or a challenge. And oftentimes when we think about stress, we think about kind of the more unproductive forms of stress, right? The stress of the pandemic, the stress of parenting, of shifting, of uncertainty. Stress can also be good. It can play a really positive role in our lives. But what we're talking about today is really the stress that doesn't quite feel so productive, right? And that could be stress that we feel internally, maybe some expectations or goals we have for ourselves, or if we're working with some kind of chronic condition or illness. It could be an external stress, like a giant worldwide event like the pandemic. It could be real, like if I were to step into into the street and a car came tunneling, kind of flying at me, my body would respond to that very real, active stressor in my life. It could also be perceived, right? So it might be thinking about a really hard conversation I'm going to have with somebody, maybe a deadline that's coming up for my work, or something that feels a little bit challenging. And it can be acute, which means it's short term and very limited. And we might know in advance what those limitations are, or it could be chronic. And it's really the chronic that we tend to worry about. So with stress, kind of the good thing to know about, right, is our baseline is not to be stressed. We generally operate in a nervous system that's geared for connection, engagement, communication. We're kind of naturally wired to try to solve problems through cooperation and collaboration. And this nervous system is called the parasympathetic nervous system. But I like to think of it as kind of like the brake for our stress response. If we get a stressor that comes in, right, this particular nervous system tries to act as a little bit of a brake, and it first tries to act through connecting, right? As we saw it with Terry's story about how he first kind of worked with the pandemic and the news of the pandemic. He connected with his colleagues and they tackled the problems through collaboration and cooperation. That's kind of what we're geared for right? But when stress becomes too much and we can't really put the brake on it, then another nervous system comes in called our sympathetic nervous system. And this is where we start to get reactions that are generally called fight, flight, or freeze, right? So if you think about an animal in the wilderness, right? An animal might try to, when it first comes up with something that's a larger predator, right? It might try fighting it. It might try running away from it. Or as we often see with squirrels and deer, it kind of might get frozen. And we have the similar response. We're all mammals in those examples. We have a similar structure in our bodies. So the stress response is like our gas, right? It's meant to take us out of the situation or to change that situation. And it creates a lot of physiological effects. There's a lot of changes in the body that happens when we have that stress response. Our heart rate increases, the pupils dilate, our blood pressure increases, energy gets pumped to our limbs, and then our digestive and immune systems slow. And that's all really helpful for us if we're thinking about, again, that car on the street, right? We want our legs and our arms to move us out of the way, out of danger, without a lot of thinking. And I think it's really critical to remember when we're thinking about stress, a lot of our reactions are subconscious, right? It's very rare that I will be able to look at a stressful situation and say, this is how I wish to respond. A lot of times our bodies and our nervous systems are choosing for us, and it's choosing based on what it thinks is going to be the best possible outcome for keeping us safe. So when we think about, that piece of the op-ed where we're talking, I love how it's the grown-ups that are perhaps having a challenge with the pandemic, and we're not listening to each other, and we're not cooperating with each other. Part of the reason we might be doing that is because we're in a stressful situation. And when we're in a stress response situation where we're trying to figure out how we're going to respond to something really challenging, we're fighting, or we're fleeing from it, or we're freezing, then all of that lovely cooperation that we might normally engage in, the communication, the listening skills, the empathy, that part of our brain shuts down a little bit. It's harder for that part of the brain to take on those responsibilities. And again, we don't always have a lot of choice about that, right? So it's not listed here, but if you ever want to know more about it, Dan Siegel, who's a psychotherapist, has a wonderful analogy where he talks about flipping our lids. And you could type in Dan Siegel, and he's got a great video that kind of describes what our brains are like on stress and how that affects how we can really engage and tackle problems. But when we're looking at stress that's like the pandemic, right? I feel like these questions really become pertinent. When we're trying to figure out exactly our capacity to handle or manage stress, there's a couple of questions we might ask ourselves. One is, how much is the stress, right? Is this stress really intense or great? Is it just one stressor, or am I feeling stress from a lot of different areas in my life? My ability to handle something that is really intense and has many other things surrounding it that also feel stressful might really limit my ability to manage it, right? How long have I felt stressed, right? So many of the panelists today talked about this anniversary we're coming up to for the pandemic. We've been in it for a long time. I think what might be interesting is that we're hopefully approaching the end point. So maybe we're starting to feel a little bit different about the stress that we're managing versus at the very beginning when there was a lot more uncertainty, when the end point was changing from 2 weeks to 4 weeks to 1 month to, and so on. And then when is this happening, right? Am I already feeling kind of at the end of my reserves? Am I coming into whatever stressful event is happening with a lot of mental and emotional and physical energy? And each of these variables really affects how easily we're able to manage, right? And how easily it is to kind of stay or put the brake on that stress response system. And again, I think it's always so important to just reiterate, like, a lot of this is being decided for us, right? Our bodies, our brains, our nervous systems are choosing pathways that it thinks it will be most safe for us, right? Which means our rational brain isn't always involved in this. There's perhaps a little bit of grace or a little bit of compassion, especially for ourselves or for other people who are also struggling in the same way. If we start to kind of take out maybe some intention around that, right? The antidote, right, or the kind of the opposite of stress is really resilience. And resilience is our ability to withstand changes and challenges and even grow from that. And the really wonderful thing about resilience is that we can strengthen our resilience. So it's not something that we have a set amount of in our lifetime. It's something that we can grow. It's something that can certainly shrink, but we can also take measures to continue to strengthen that. So Joe and I are going to talk to you a lot about what things we can do to strengthen that resilience, just have that kind of brief understanding of what might be happening physically, mentally, emotionally with stress. One of the best things we can do is moving our bodies, be it in the form of taking walks, exercises, Tai Chi, yoga, whatever your form of movement is. Moving releases muscle tension, right? If you think about that stress response system where we're primed to move, it also releases endorphins, which are feel-good chemicals. Connecting with other people helps press the brake, right? Especially if those people are people we really enjoy and we love to be around. And that also stimulates other feel-good chemicals, right? So we kind of get these natural ways of dampening down that stress response and bringing on that nervous system. That's kind of our baseline, that engaging, connecting nervous system. Another thing we can do is what we did at the beginning, which is to breathe deeply. And I will confess, as a yoga therapist, a yoga teacher, this is my go-to. Our breath is really responsive and adaptive. It reflects our mental, emotional, and physical state. And it does that, again, without a lot of conscious effort on our part. But we can consciously change our breath. And changing our breath can sometimes change what's happening in our bodies or what's happening with our minds. Sometimes, right? Not always. So if you're thinking about ways that you might breathe, there's wonderful breath practices all around in the world. I like to talk about ratios because I think that's just a little bit easier. So if we think about a 1-to-1 ratio, that's where our inhalations and our exhalations match each other. And you can, if you're focusing on your breath, you could count your breath to see if they start to match each other. It's a more balancing way of breathing, right? We're going to try to encourage just a little more evenness for ourselves. If we want something that's a lot more calming, then we might emphasize the exhalation. And that's when the exhalation goes twice as long as an inhalation. And again, we could count. Counting is great for the mind. It's great to focus the mind and the attention. We could also think about breathing in through the nose and then out through the mouth. And generally that kind of a breath elongates the exhalation. Or maybe we're really exhausted and we don't want to add more caffeine, or we're not using caffeine. It's that time of the day where we just feel a little bit tired. We might want a breath that's a little more stimulating, in which case we're going to emphasize the inhalation and see if we can make the inhalation twice as long as the exhalation. So we can play around with our breath a little bit. I'm going to hand this over to Joe now. He's going to talk about strengthening resilience at work.
Thank you, Winter. And I love doing presentations with Winter because I get to do those breathing exercises with her. And we're gonna save a little bit of time at the end to do another exercise. But to answer Terry's question about TeamSteps, TeamSteps is a communication platform in healthcare, and it's about safety. And I became a TeamSteps master trainer because of my safety work. And what's really important, what I found, and it's one of my mantras in the safety work, is a resilient employee is a safe employee. And also a resilient employee is an engaged employee, and is a happy employee, and is a retained employee, and all these things that we seek as business owners or leadership. So we want to keep people, we want to keep them engaged, we want to keep them happy, we want to keep them working. So what's really important, I'm going to give you, we can't just say be resilient or, feel better. We want to give you a couple of tools. And the ones I'm going to talk about are going to be either you can use them personally, you can use them with your families, you can use them with your employees. The great thing is that they are easy and they're free. So we'll just go from there. Next slide, please, Winter. So I'm not gonna go through all the details of these slides because they said they're going to give them, but I'm going to hit on the main points of this. And this is a Gallup meta-analysis of businesses. And there were 5 key factors to improving profitability, productivity, and so on. And I highlighted mission and purpose because you can use mission and purpose to make your employees more engaged and more resilient. Next slide, please. So, for example, at Valley Care, our mission is to care, educate, and discover. And our values are healing humanity through science and compassion, one patient at a time, which are great. But how does that relate to the bedside nurse? How does that relate to the physical therapist and outpatient? How does that relate to the food service worker or the EVS worker or the security guard? And what you have to do is you have to really give your employees a vision of why their work is important. I'm dating myself, although I guess I was dated in my intro. If you all remember the Bob Seger song, "Feel Like a Number," right? If you're somebody that just doesn't feel connected to your work, you're going to go through the motions. I remember going in the beginning of the pandemic to certain coffee places, and some places the people were really friendly and happy and kind of we're in this together, and others look like they didn't want to be there, and that reflects on your business, right? So you want to give your employees a reason to relate to the importance of their work. And I'll give you a really quick example. We did a presentation with our food and nutrition people, and I said to them, "What's your job?" And they said all the right things. We bring trays to patients, we wash the dishes, we cook food. And I said, "No, your job is you save lives." And they looked at me like, "What are you talking about? I'm not a doctor, I'm not a nurse." And I said, "But wait a minute, you provide diabetics and people with hypertension and people who can't swallow with the proper meals, right?" And they said, "Yes." And I said, "You provide people nutritious meals whenever they need it so that they can get stronger and healthy and go home, right?" And they said, "Yes." And I said, "Then you save lives." And you could see them sitting up a little straighter and feeling a little prouder about what they did. So whatever your business is, think about, get away from the tasks and the titles and help your employees see what are they contributing, because the contribution to our community, to our society, that's what's really going to connect your employee to your business. Next slide, please. Another study that was really amazing, and we learned about this several years ago at a Stanford summit. Ernst & Young partnered with this company called the Energy Project, and they were turning over CPAs 50% at a time every year. Tax season would come, they would grind them for 20 hours a day, and then at the end of tax season, they would lose half their accountants. And the Energy Project came up with 5 things, and they said, please, they told the accountants, do these 5 things. And at the end of tax season, instead of losing 50%, they lost 1. And the things that they did were very basic. Some of the things Winter talked about, but these are things that encourage your staff or yourselves to do this. When you first get in, do a vice president of mine in the past used to say, eat the frog first. Do the hard or the important thing in the beginning of the day, and you get that out of the way. And multitasking is an energy, it steals your energy, it steals your attention. So I always emphasize avoid multitasking. Getting up at lunch, walking around, doing something other than working. Next slide, please. Taking the break, and Winter gave you some great breathing exercises. 1 minute, even sometimes 15 seconds will be enough. So you do your breathing. then the transition from home, you need to make that break. You can't be working all the time, but you want to be present for your family or your hobbies or that kind of thing. So make sure you encourage that, and enough sleep. A lot of work on that. We are actually working on a class about proper sleep, because it does affect people so importantly to get proper sleep, or if you don't. And so a lot of these things, you as employees, you can encourage people, hey, did everybody take their break, or let's take a walk at lunchtime, or all kinds of things that you can encourage yourself or your employees to do to make them more productive during the day. Next slide, please. 3 good things. This is one of my absolute go-tos, and at the end, Winter put together some resources. And one of the things, there's a 3-minute video, and then there's a little longer, a 10-minute video. J. Brian Sexton is a researcher at Duke in positive psychology. And a couple of their mantras are that negativity screams and positivity whispers. Or another is that negativity is Velcro and positivity is Teflon. You could have a great day, and if your last customer or your last phone call of the day is a bad one, you're going to go home and your family's going to say, how was your day? And you can say, it sucked, because you're really going to remember that bad thing. And in fact, what Dr. Sexton found in his research is it takes 3 good things to counterbalance 1 bad. So you may have 3 great customers, 1 bad, 1 good customer, and you're even. So 3 good things have to offset bad. And there's more detail to it, but it's a practice at the end of the day. 2 hours before bed, you think of 3 good things, because we can always find 3 good things. But we also use it, we do it before staff meetings. We do it in our morning huddles. And when we leave the huddle, and a lot of times people say, it was a really bad day, but I did this. By the end of the huddle, we're laughing, or we learn something else about each other, so we're more connected. So it's a really powerful tool, and I would really encourage you to watch the video. Next slide, please. And finally, gratitude. And Terry talked about this in the beginning. Again, showing gratitude to your employees, or even your family, anybody, is a very powerful way to establish connection. And some of these things that are important, that honestly and timely and freely, I know we say, hey, everybody, you did a great job today. And that doesn't mean as much as if you say, you know what, Winter, that customer was really difficult, and I really appreciate how you stuck with it. And then you connect it to your purpose to say, because I think you saved that sale, or you saved that relationship, and they're going to come back. And those are the kind of things that connect people, again, to their business. When they hear gratitude that's not generic, not an email, but verbally, or even another a really powerful tool is called a gratitude letter, and that will be in the appendix also. I'd like you all to think about either someone in your family or your circle of friends or at work, and think about somebody who you really would like to thank, and you handwrite them a gratitude letter and you give it to them, and even better if you can read them. There are videos on gratitude letters that will just absolutely convince you of the value of this. But if you do it timely, if you do it honestly, if you do it freely, it doesn't cost you anything other than your time and a few words, and you establish an excellent connection with your employees. So those are just a few tools that wanted to throw out, things that I do in my department that I found to be really helpful, both from a professional standpoint and a personal standpoint. And so as I look over at the time, I'm glad I saved enough time to hand it back to Winter.
Thanks, Joe. So before we end, we wanted to offer one last small practice, if you're so inclined, similar to what we did at the very beginning with our breathing. So if you'd like to join in on this little practice, I invite you to once again find a really comfortable position. And to notice whether you wish to close your eyes or to focus on something, some very specific spot, and then soften your gaze around that. And just as we did earlier, see if you can bring your attention to your breath. And watch your breath as it comes in. Watch your breath as it goes out. And just for a moment, watch the cadence of your breath as it comes in and out of your body. Now you might continue watching your breath because this might be exactly what you need right now. You might see if you can think of one good thing that's happened in the last 24 hours. And it could be a small thing. It could be a big thing. One good thing that happened in the last 24 hours. And as you're thinking about this one good thing, see if you can, if it's almost like a memory, if you can paint it as vividly as you can, this particular moment, this particular good thing. Can you use all of your senses to really think about this good thing? Who was there? What sounds or voices did you hear? What time of day it was? If you could smell anything or taste anything. Thinking about this one good thing. And you might linger in this memory. You might linger in thinking about this one good thing. Or you might see whether there's any feelings or sensations that arise as you think about this one good thing. And again, no judgment, no expectation there. Simply an opportunity to observe. Does anything happen as you think about this one good thing? And when you feel ready, maybe either leaving this memory behind or taking a portion of it with you, you can start to bring yourself back into your space. You might visualize the walls or the ceiling and the floor. So you can find yourself in your space. And when you feel ready, when you're more fully in your space, you might open your eyes or lift your gaze. Thank you so much for sharing your practice with me, sharing your time with us. I'll turn it back over to Terry. Thank you.
Thank you, Winter. Thanks, Joe. Appreciate your time. That was terrific. I had, Joe, your last slide up on the screen. So rather than close my eyes, I was able to really focus in on the word gratitude, and it helped me to really zoom in on what I'm grateful for. So that was really nice. A quick question. I'm wondering if we talk a lot about, things that we have benefits of the pandemic, right? And things that we have learned, and maybe ways that we've now kind of forced us to think out of the box. And going forward, we might do some things differently, right? A whole virtual work setting is this whole new paradigm, I think, for a lot of people. So when it comes to stressors and, basically what our topic is, anything that you think we have learned during this time, this past year of sort of forced isolation, that we could look to as sort of benefits moving forward as the fog lifts?
I'll jump in first if that's okay. And I think what we're doing here today, right? Because it's forced everybody to, not be go, 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 go. You're at home, you're reflecting, you're in smaller groups. The things that we've talked about today, gratitude and appreciation, to me, has become a little bit more important, needed. And I think people are recognizing that. We Winter and I have done work throughout the hospital. We've done presentations to other places because we believe in it, but sometimes it takes putting on the brakes and really reflecting on what is important and what I can do, non-material things. I talked about the things that we're talking about. It doesn't cost you anything, a piece of paper, a few minutes, a few words. And for me personally, I really am grateful that more people are cognizant of this and getting involved in it.
Great,
Winter,
thank
do you
you.
know anything?
Thank you very much. Winter, anything to add to that?
I do. One of the things that struck me as as Mina especially was presenting is how much innovation occurred, right? At the start of the pandemic, I think about all of the rapid changes that people not only managed, but succeeded in, right? Whether it's our educators, whether it's our small businesses, all of the pivoting and the shifting, it's all really stressful, but it's also so remarkable. Just really that our ability to do that, right? It just really showcases, I think, this wonderful power of the human spirit and of human nature in general. That just leaves you. I'm sure we could, continue to look at ways that we want to improve things, but there's been so much that has happened already. So many people stepping up in so many different ways that courage that you talked about in that op-ed, I think has been present, right? It's been present throughout the pandemic, and to me, I think that's something that maybe the pandemic allowed us to really see a little bit more, right? Maybe.
Yeah, no, that's wonderful. I appreciate it. I liken it to my mother-in-law, who's in her early 80s, and how she was able to navigate the whole Zoom and FaceTime and all of that environment. Now we can't get her off. Right? We're like, Sally, turn the camera off, please. It's time. It's time. We've seen enough. Okay. We do have one question in the Q&A, which Mino did answer, but I wanted to just put it out to the group. From the lovely and talented Laura Steinbeck, do you foresee those under 60 with no underlying health conditions getting access to a vaccine prior to July? Mino, you want to speak to that real quick?
Yeah, I absolutely do. I'm very optimistic. I don't have all the facts behind me, but I'm going to say yes. I think with the delivering of the J&J vaccine as well, which is a single dose, and what President Biden has purchased for this country, I think you're going to see a lot more acceleration of the populations getting the vaccine sooner than maybe expected months ago. So that's my hope. I know there could be setbacks, as there always are in certain administrative things, but I feel really good. By May, June, we're going to see the numbers hopefully skyrocket, and my hope is certainly by this summer, a good portion of our population will be vaccinated.
Excellent. Well, I just booked our trip to Cabo in June, so I'm not pulling back from it. So I'm trusting
Keep
you.
it. Hold on to your ticket. Yeah.
So thank you, Laura Steinbeck, for that question. Laura, by the way, Winter, when you talk about, I like the whole concept of endorphins, and you called it releasing feel-good chemicals. I know Laura, and she usually waits till 5 p.m. to release her feel-good chemicals. But the pandemic, I think, has caused her to start releasing feel-good chemicals around more like 12 or 1:30. So anyway. All right, I think we are about wrapping up. Stu, I am going to turn it over to you for any closing comments.
Terry, could I reply to Michael? He did have a question, and I think it's an important one, and I can do it really quick. He talked about damage to children, and Michael, great question, and I'm not sure if it's not really a controversy. Children have been terribly affected by this. But what I wanted to throw in was that everything I talked about can be used with children. Teach them gratitude, do 3 good things, accent the positive. Positive is really important. Gratitude for what you have, your safety, your community. I think if you accentuate those things with your children as well as yourself or your coworkers, it will be of benefit. So I wanted to make sure Michael got answered there.
Great, thank you. I apologize, Michael, for missing your question there. Okay, Stu, closing comments.
Well, thank you, Terry. We really appreciate all your support. Thank you, Stanford Healthcare Valley Care, for putting on this presentation today. It was an excellent job. Thank you to all of our presenters, and of course, Maria Cooper from Above and Beyond Productions for handling all of our technical aspects. Now, we will have another upcoming seminar in the near future. The topic is yet to be determined, but it'll be very informative as this one was. So again, thank you everybody for just doing a great job. And we're so fortunate to have such a great healthcare system right here in our backyard. So thank you, and everyone have a great day. Thank you so much.
Thank you. It was fun.
Yeah.
Thank you for having us.
Everyone.